kudos to the governor, Senator Mondo, for the good job, and his Commissioner of Health, Siri Oshomole. They've done a great job.
At the University of Benin Teaching Hospital, Benin City, Edo State, a recent research discovered a bacteria called diphtheria, which affects mainly the respiratory part of the body. The outbreak is caused by a highly contagious bacterial strain that poses serious health risk if not treated promptly. Early detection and timely medical interventions are critical, as survival rates are significantly higher when treatment begins in the initial stages of the infection. Commenting on the development, Dr. Fidelis Eki Idoko, Deputy Chairman, Medical Advisory Committee, Training and Monitoring, UBTH, Head of Pediatric Emergency Unit and a pediatrician, said so far 3 deaths have been recorded as patients were rushed in at already in a critical stage, saying that the bacteria is very much curable and survival rates at 100% when detected early, as flagged areas are down Oluku, Sapele Road and Ipobahi Axis.
And the name of the bacteria is referred to as coronary diphtheria. It causes diphtheria. Diphtheria is a bacterial infection, mostly caused by droplets, sneezing, cough, catarrh. It's actually contagious. It's one of those vaccine-preventable infection. What we have noticed in UBTH in the last couple of weeks, we have received about 10 cases of this bacteria in children, and we have recorded 3 deaths because they came very, very late. In fact, they were already in failure. Some spent less than 3, 4, 5, 6 hours. Then we had 2 that have been discharged out of the 10. Then 5 are currently still in the ward undergoing treatment, but they are very stable. Their chance of survival is almost 100% sure.
Medical experts warn that delayed diagnosis or inadequate treatment can lead to severe complications and even death. UBTH has ramped up surveillance and is urging parents and caregivers to watch for symptoms such as high fever, persistent cough, and difficulty breathing in children.
This bacteria, like I said, is most often the symptoms and signs of people that have this bacteria are mostly cough, catarrh, sneezing, sore throat. They are tired, fatigued, and sometimes they refuse to eat. And in worst cases, they can start vomiting. Now, the problem is that most people they always mistake this infection for the regular cough, catarrh until they start having complications. What we noticed from the people that came to us, some they actually had gone to some other private hospital. At the very bad cases, they have swollen neck, almost looking like a bull neck. Some of them were actually diagnosed as cancer. They thought it was called a lymphoma because the lymph nodes will be enlarged. You can palpate it, swallow lymph nodes all over. So they came to UBTH. At the time that child was coming, that child is a 13-year-old. Was actually a respiratory failure. I had to pass a tube through the neck to prevent the child from succumbing to inability to breathe. So that's kept the child going, and with the treatment we instituted, he's one of those persons that have survived and is doing very well.
In a swift response to the outbreak, Edo State Governor Senator Monday Okpebolo, through the Commissioner for Health, Dr. Cyril Adams Oshomole, have commenced necessary supplies in curbing the spread of the bacteria at the teaching hospital. BTV News captured the delivery of the materials. Though no cases have been recorded in adults, but authorities are calling for increased hygiene measures and public awareness to contain the spread of the bacteria.
So our plea as a teaching hospital who receive these kind of cases is, one, to our parents. If your child is having cough, catarrh, sore throats, and is finding it difficult to eat, despite your treatments in other hospitals, it is good to seek for expert care, just to be sure that this case is not actually diphtheria. The few ones we lost were because they delayed in terms of the time they presented. They came late. In fact, they were actually actively dying. as at the time they came. So we're already bluish and they can't breathe anymore. It affects both children and adults. We've seen the cases for children, but it's possible to have adults too. But the outbreak as at now is more of children that we've seen. But adults are not immune. There's possibility that adults can also be affected. Yes, it is. But again, the children, because they're the constitution of these children, their ability to fight infection is different from adults.
Efforts are ongoing to provide affected children with the necessary medical care and to prevent further infections in the community, both by the state government and the teaching hospital. The hospital and local health departments continue to monitor the situation closely as investigations into the outbreak source and spread are underway. God's Gift Omone reporting for BTV News.